Good morning, guys. Happy Saturday. Today is February 28th, 2015. I wanted to give you guys a little update after the surgery I had last Thursday on the 19th to remove lymph nodes, and I wanted to give you an update of the results we got from that, as well as the results of my PET scan that I had done on this Wednesday, the 25th. And then that was kind of determine, just see how things have been progressing and, if anything additional needs to be done as far as my treatment or anything like that. So with my surgery, what the results showed is that a total of 14 lymph nodes were removed and tested in a sac of fatty tissue, and those were separated out and dissected and tested. And 3 out of the 14 of those, the axillary lymph nodes were cancerous. And it also does look like that it was all that the cancer in that area was all removed, because pretty much all of those lymph nodes were taken out. So, and the surgery went really well. Definitely a lot better than expected, which is good. I am healing and recovering nicely. I do have to kind of do some rehabilitation for my right arm. I don't have complete mobility, 100% mobility back yet. So I do have to be still a little careful. I can exercise and work. I just have to be careful and just pay attention, if my arm starts, like my arm started bothering me a little bit today. So I'm just, I'm taking it easy for now. And stuff. And I did get my drain out on Thursday. So, which was nice to get that thing out. 'Cause that is, any of you, breast cancer fighters out there and survivors who've gone through this know what the nasty pain in the butt the drain is. When you have to have those done, when you have to have those in. And so anyway, so that went really well. And then we got the PET scan results back yesterday when we met with my oncologist. And there are some potentially bad, the news is there's some bad, and then there's some we don't know 100%. The problem is that the PET scan was done so soon after my surgery, so there are some skewed results. So it just makes it harder to read, because with surgery, cutting into the body, there's some inflammation that lights up, that can light up on a PET scan. And since it was so soon after my surgery, obviously my right armpit area, and that area right there where I had my surgery, was lit up because and was inflamed on the scan images. And then there was also a couple of new spots that lit up. My rib cage area, my chest, my right chest area. Nothing on my left. This is all on my right. So there's a couple of new spots that lit up. But we don't know if that is a result of inflammation from my surgery, or if those are new little cancer seeds that have sprouted up. The one area that we already knew about from before, in the middle of my chest area, the little tumor in my chest area, has actually shown that it has doubled in size. And yeah, so that's doubled in size, and that has lit up even more than it did on the last PET scan since then. So, which means is that it didn't respond. It didn't, those first 4 rounds of chemo that I did, didn't have any effect on it. And that is actually a rather difficult area to operate on. The reason why it hasn't been done yet, I don't know if I've mentioned this in past videos, but the reason why it hasn't been done yet is because of the location. because it's under my chest muscle. We don't know 100% for sure if it's, near my lung or if but it's the center, right here, the center of my chest. And so, and cutting into that muscle would just cause further long-term, damage and chronic problems down the road. So that it just makes it more difficult. And that's something that my oncologist said would be treated, with the next 4 rounds of the chemo that I'm going to be doing. So it's not what we necessarily wanted to hear. So what the plan is right now is that we are going to pick back up with chemo. I'm going to finish out those next 4 rounds of the Taxol. I'm actually already scheduled for this upcoming week on Thursday, the 5th, March 5th. And it'll be every 2 weeks. And then the plan is to finish out with that, finish those 4 rounds, and then do, more testing. We're going to have to do another PET scan, so we can get more accurate and see, the hope is that the Taxol is going to shrink the tumor in my chest area. And if those 2 new ones are in fact, cancer tumor, if those are, new cancer seeds, hopefully those will shrink, but we don't know what the 2 new ones are. So it's also why we're going to do additional testing to see if the chemo worked with the one in my chest, and to see if the 2 new ones are just a result of inflammation from surgery, my body healing and everything. So we can get a more accurate, reading at that point. And we are also for sure going to continue with radiation. I think I had said before that it was a possibility I may or may not need it, but we need to now at this point, since I have the tumor's gotten larger in my chest. So we're going to continue with the 6 weeks of radiation, 5 days a week. And everything after that, after all that. And then at that point, and then if, these 4 rounds, if these 4 rounds of chemo and the radiation don't have any effect on the tumor in my chest, then my oncologist is saying that we are just going to, we're going to have to do more rounds of chemo. And I would continue with the Taxol. And also during this time with all this stuff, my oncologist is also going to be retesting me, my HER2 and estrogen receptors. I know I was originally diagnosed triple negative, everything to, my HER2 and estrogen, that stuff. I'm triple negative, and my oncologist wants to retest just to confirm, because of this latest development. He wants to retest and confirm that they are negative, because if I'm not, if it turns out they end up coming positive on one of them, sorry, I'm trying to still process everything since yesterday, but on one of them, I'm trying to remember if it was the HER2 or the estrogen. I apologize. If one of them comes back positive, I will have to take an additional drug post all my treatments for a year. I'll have to take a pill form, and I forget what it's called offhand. There's one that starts with an H that goes with the HER2 if I'm positive for that. And I believe that's the 5-year or the one, I'm sorry. Yeah. Sorry. It's just a lot of information yesterday. I apologize. And then if the other one comes back, if the other one comes back positive, I will have to take, so I'm looking at possibly if either one of those comes back positive when those are retested, that I will have to take the additional pills and medication post-chemo, post-radiation for either 1 year or 5 years. So, that's at that point, that's you know, it's making it harder as far as, you know, we want to have a second child. And so we're, you know, kind of making plans and just kind of waiting and seeing how things are going, you know, just doing what we need to do. And then, yeah, so after, obviously, and then I'll still be down there, I'll be having my reconstructive surgery as well, still. So, I think that's pretty much it. Like I said, I got a lot of my husband came with me. We got a lot of information yesterday. So some bad and we don't know news. So which is, you know, it is what it is. You know, we are trying to, you know, we're focusing on just, you know, staying strong and positive and doing what we need to do. You know, it's just going to be a little bit of a longer process. You know, and that's it. And, you know, it's focusing on just, yeah, I think that's pretty much all I got. I'm sorry. I'm just all, you know, if I'm all over the place today. So it's kind of been a, you know, crazy with my surgery, healing and recovering. And my doctor's appointments and tests and things this week. It's just been a little nutso for me, emotionally, mentally, just, you know. So anyways, I want to thank you guys, as always, for the continued love and support. And, you know, if you have any further questions or anything like that, feel free to reach out to me on Facebook or, you know, and whatnot. And I always respond to things as quickly as I can. And then, you know, always thank you for the love and kind words and prayers and inspirations and you know, support, everything. We definitely appreciate it. And, you know, we'll do another as things, you know, get closer to my chemo and, you know, anything new, like I said, you know, we'll keep you updated as much as we possibly can. And, I guess that's it. We'll talk to you guys soon. We love you. Bye.